this is your Houston chiropractor at Advanced Chiropractic Relief, and we have Ruby in here with us today. And Ruby has been seeing us for the past couple of months for some low back pain and sacroiliac joint pain down in her pelvis. It's just creating sciatica or leg pain. So we're going to show you how we treat that. So let's go ahead and take a look at your posture here first. I'm going to have you close your eyes and flex your head forward and backwards for me, please, Ruby. And then neutral, yep. She's just got a little bit of translation and rotation, but her posture is so much better these days than when we first started, huh, Ruby?
Oh yeah, so much better.
Okay, very good. So we're going to put her on here, and we're going to, because she has a lumbar spine with discs that are bulged and compressed, we're going to decompress her entire spine manually. On our YouTube channel, our brand new YouTube channel, Advanced Chiropractic Relief, by the way, is the name of it, you will see nothing but actual treatment videos on actual patients with certain conditions: herniated disc, bulged disc, hiatal hernia, herniated disc in the cervical spine, even patients who have had surgery and have screws and plates and pins and rods in their spine. And we really appreciate you subscribing, watching, commenting, and sharing our videos, especially on Google Plus and Facebook. Okay, let's have you take a nice deep breath in for me now there, Ruby, and let it all out and relax. Just like that. Boy, that was a home run, wasn't it?
Yeah.
Good job. See, Ruby handles that better than most of the big men you see on here.
Every now and then I get
Yeah, you did good. No, you do a lot better than most of our 300-pound, 6 to 8 people, men that are coming in here that I'm treating that are athletes. Women are much better about handling pain in most cases than men, although this is really not that painful once you get started. The first one's the worst one because it rips loose scar tissue and adhesions that form in and around the joints of the spine, but that's what gets people better when you get rid of all that. Okay, let's roll over this way on your side, Ruby. There we go. And have you lay on your tummy for me right here. Yep. Okay, now she has a leg, just relax your foot first. There we go. That was short on the right, it gets even. You set tighten it up a little bit in your low back hump. Yeah. At the end there. So she has a positive nocculus and a Deerfield on the right. So we're going to adjust her right SI joint first. Remember, she's got low back pain, sacroiliac joint pain, and sciatica, which is leg pain or radiculopathy. Lumbar radiculopathy is another term for that. But a lot of people think that sciatica can only come from a lumbar herniated disc. That's not true at all. In fact, most of the time, sciatica comes from a combination of the lumbar spine, right where it meets the sacrum or the pelvis, called lumbosacral spine, and the sacroiliac joints, the nerves that come out of there, also form the sciatic nerve, and that's where most people get the sciatic pain from in their legs, one or both legs. Oftentimes people will have a, boy, she's moving good today. You're awful noisy. They're loving that. We have a lot of crack addicts out there that watch us. They're loving our cavitations in the spine. There we go. Excellent. Good job. See. Legs are even now. Tell me how this feels versus the first time. Is that smoother? Easier? Good. Now when Ruby first came in, her pain level was up there at 7, 8, 9 levels, but last few times she's been coming in here now, actually for about the past month, it's been down to 1s and 2s, huh? Now sometimes she'll get exacerbations of her condition if she takes long trips to, out west of San Antonio or long car rides exacerbate, long periods of sitting exacerbate, or sleeping wrong sometimes will exacerbate the condition. So sometimes she'll come back in with some increased pain. You had one of those recently, didn't you?
Yes.
On a car trip. But it went away right after one adjustment, huh? Yeah, this is only the second one after that, and you went from high numbers up there back down to 1 today. And we don't use the turbinator on her because she doesn't have that much muscle on top of her bones, and I don't want to hit her bones with that turbinator because that's a deep, deep penetration, so we don't want to fracture her spinous process or transverse processes off. Ruby appreciates that too, don't you, Ruby? That we don't fracture your back.
One more problem.
There we go. Very nice. That was much easier. Okay, let's turn you on your back for a second. There we go. Okay, just let your whole leg relax. There you go. Should have felt that in your knee and your back. Here. Yep, good girl. Feel that in your knee and back too?
Yes.
Good. Okay, let's sit you up and face towards your knee over that way. There we go. Alright. And we're the only chiropractor in the U.S. that actively uses the manual spinal decompression maneuver technique that I've developed. There we go. Good. There's one up in Auburn, California, Dr. Daniel Murphy, who has a table just like that. In fact, it's one of my old tables. And then there's another guy who actually taught me this technique down in St. Petersburg, Florida, Dr. Russell Jansen.
I thought it was Clearwater.
Clearwater, excuse me, you're right. St. Pete, Clearwater's all together right there, Tampa, St. Pete. But he's in Clearwater, you're right. Very good. Okay, Ruby. Would you mind sharing with our YouTube subscribers on our brand new Advanced Chiropractic Relief channel how this is done for you overall, and would you recommend this to your friends and family?
Oh, very much so, because I was in severe pain whenever I first started several months ago, and it took a couple of the treatments to get me on my way, but with each one I advanced, and now it's like a 1. Sometimes when I leave her, it's usually a 0. Yep. It just eliminates all of that, and as long as I halfway take care of myself and be sensible about it, then this really helps. I would recommend it to anybody. I don't know what I would do without it.
Well, and we were adjusting you regularly at first, and then once we started decompressing you is really when you started seeing the biggest results, right?
That was probably
the 4th or 5th treatment?
Yeah, 4th or 5th treatment. We just did this over here.
Right.
And then you started that almost every time, and
right.
It just
and that's really what's clearing it up, right?
Yeah, it's
yeah, that manual spinal decompression works from your skull all the way down your spine, so that was really...
And it's really not painful, you just give a big ooh.
It looks worse than it is, right?
Yeah, it's not really painful at all.
That's great. Well, thank you for sharing that story with us, Ruby. Let's come over here and shoot you now, after that nice story. This is a Atlas-specific adjusting instrument that I utilize to retrain the cerebellum back here, how to hold a person in place. So I'm going to have you flex your head forward and backwards again, Ruby. And she's got good range of motion. Her posture's already improved. We're just going to have that come back here and improve on that a little bit more. Now shift your pelvis straight right. There you go. Hold that right there for just a moment. There. And right there. Good. Okay, now relax everything again. And flex your head forward and backwards again. Very good. Now that was easier, wasn't it?
Oh, yeah.
Now, a lot of times people wonder why I'm doing this. It's not because I'm getting lint off of the shirt or anything. It's to actually improve the positive electromagnetic energy that runs through the body and chi. So every time you see me doing this, I'm just leaving a positive impact on their electromagnetic energy. Okay, Ruby, This is your Houston chiropractor and Ruby coming to you
Okay,
from Advanced
very good.
Chiropractic Relief.
Very good.
And we'll see you next time.
Okay, bye-bye.